In this video, we shall be classifying the drugs used in heart failure. It is important to understand that the drugs used in heart failure come under two completely different groups. These include the drugs used in chronic compensated heart failure and the drugs used in acute decompensated heart failure. Now, a patient who has suffered from some sort of primary injury to the heart, like for example a myocardial infarction, may survive and live for many more years. However, prolonged changes in response to the primary injury, often called the index event, can lead to progressive changes, and these progressive changes lead to progressive disease, which we call heart failure. Now, there are drugs that delay the progression of heart failure, and these are the drugs which we say are used for the treatment of chronic compensated heart failure. These are typically drugs which are taken orally, daily by the patient. They help the patient perform the patient's normal day-to-day activities. Right, so the drugs used in chronic compensated heart failure include the ACE inhibitors, or if they are contraindicated, the angiotensin receptor blockers. They also include the beta blockers, the orally administered loop diuretics, mineralocorticoid receptor antagonists, fixed dose combinations of hydralazine and nitrates, ivabradine and cardiac glycosides. Now, most ACE inhibitors are suitable for the treatment of heart failure. However, not all angiotensin receptor blockers are suitable for heart failure. Only 3 are commonly used, and these include valsartan, losartan, and candesartan. Similarly, not all beta blockers are suitable for heart failure. The beta blockers which are commonly indicated for heart failure include carvedilol, bisoprolol, metoprolol, and nebivolol. The orally administered loop diuretics suitable for heart failure include furosemide and torsemide, and the most commonly used cardiac glycoside for heart failure is digoxin. The newer guidelines do recommend the use of ARNIs, or angiotensin receptor blockers, and neprilysin inhibitors for the treatment of heart failure. These drugs are recommended over the ACE inhibitors. The ARNI which is currently recommended includes valsartan plus sacubitril. Now, if this particular patient suffers from yet another injury to the heart, such as for example an MI, this patient can go into acute decompensated heart failure. Now, such a patient will have to be treated in the emergency department and subsequently in the ICU till this patient is stable. Most drugs used in the treatment of acute decompensated heart failure are consequently parenterally administered drugs. Now, it is worth noting that if a patient with chronic compensated heart failure on medication suddenly goes into acute decompensated heart failure, then the drugs used for chronic heart failure are best withheld, and this is particularly true for the beta blockers. Beta blockers are first-line drugs in chronic compensated heart failure, but they are contraindicated in acute decompensated heart failure and therefore should be withheld. So, the drugs used in acute decompensated heart failure include the intravenously administered loop diuretics, some vasodilators, inotropic drugs, and vasopressin receptor antagonists, the V2 blockers. Now, as far as the IV loop diuretics are concerned, it is permissible to add thiazide diuretics when necessary. The vasodilators used for heart failure include nitroglycerin, nitroprusside, and nesiritide. The inotropic drugs used for acute decompensated heart failure may be those which are recommended by the guidelines and certain other inotropic agents. Those recommended by the guidelines include dobutamine, dopamine, and milrinone, as well as its congener, inoximone. Other inotropic agents which are used in acute decompensated heart failure as a last resort include epinephrine and norepinephrine, levosimendan and pimobendan. V2 blockers are used in the treatment of acute decompensated heart failure in certain situations, and these of course include tolvaptan and conivaptan. Now, if the patient improves, if the condition of the patient improves, then drugs used for acute decompensated heart failure should slowly be tapered and stopped. It is worth noting again that many of the drugs used in acute decompensated heart failure, though life-saving in the short term, can reduce life expectancy, and this is again particularly true for the inotropic agents. Now, once the patient is shifted out of the ICU and the patient is relatively stable, the drugs for chronic compensated heart failure may be reinitiated, and they should be started at very low doses and titrated slowly over a period of a few months. Now, as discussed earlier, many of the drugs used for ADHF, though life-saving in the short term, can reduce life expectancy, especially the inotropic agents. Now, we should note that digoxin is an inotropic agent. It is, however, not commonly used in acute decompensated heart failure. It is an inotropic agent which is used for chronic compensated heart failure, and when used appropriately, digoxin is not associated with reduced life expectancy. Now, can digoxin be used in acute settings? Yes, it can. This is true when digoxin is used for patients with heart failure with coexistent atrial fibrillation. In such patients, the patient may have to be given a loading dose, but it may be remembered that loading doses are not required for chronic compensated heart failure in the absence of atrial fibrillation.